this becomes a balance of giving the most benefit with the least amount of risk. Who gets the most benefit? The patients that start with the least disease, so less disease at the start, and who have less disease at the end. And what I mean with that is the lower PCI score you start with, the less disease around the abdomen, the less amount of tumor you have, the better you're going to do long term. These are survival curves that show how patients do over months and how many are living at certain time points. So the higher you are on the curve, the better. And so the patients that have less disease do better. This section is the patients that end with less disease. Those that we can get a complete cytoreduction on do better. So patients here at the top had no residual disease or CC0 versus others that had CC1 or CC2 and 3. The best patients are those that get all of the tumor out of there. And this is kind of shown in study after study after study in our field, is that if you get disease out of there, you're going to do better if there's nothing remaining. Second best is going to be that CC1. The third best is if there's still disease remaining at the end. So quite simply, the amount of weeds you start with in that garden matters, but so does the quality of the lawnmower.